From the Toronto Star, I'm Adrian Chung, and this matters. The Omicron variant is here, and news about it landed like a bomb.
International concern this hour over a new coronavirus variant that scientists say could be more infectious than previous strains.
The new Omicron variant of coronavirus is likely to pose a very high global risk. That's the warning from the WHO.
One of the ways officials in Canada are taking action is they are limiting exposure by limiting who can come into Canada now from these countries of concern.
The variant has already been found in more than a dozen countries around the world in a week, and everyone is asking, is the pandemic about to get worse? But let's just take a breath here. What do we really know about the Omicron variant right now? The key questions for every new variant at this stage of the pandemic: is it more contagious? Is the illness more severe? And how will our vaccines and antibodies respond to it? On This Matters, we're joined once again by Dr. Sumon Chakrabarti, infectious diseases doctor at Trillium Health Partners in Mississauga. We'll cut through the noise of speculation on the Omicron variant and explain what we know and what we don't. Dr. Chakrabarti, always great to have you on the podcast. Thanks for making the time to chat.
Pleasure to be here.
You know, we've seen some familiar patterns in the first reactions of the Omicron variant. We've seen worrying headlines, some alarmist reporting, international borders being shut down. And on some level, that is understandable, right? You know, we're all worried about what this variant means, where the pandemic is headed now. But I wanted to take a step back for just a moment and get to the basics of what we know and what we don't know. So let's get really basic. What is the Omicron variant, and how is that different from the other existing variants?
Yeah, I mean, there's been a lot going on the last couple of days, hasn't there been? I mean, if you look at it, it does seem a little bit like Groundhog Day. But I think that one thing I do want to mention before I say anything here is it's important for us to remember that we are in early days. And on one hand, I don't want to panic. I also don't want to discount the fact that we need to know more about this variant. But, you know, I think that the knee-jerk reactions are something at this point of the pandemic, we should really know better, given that we've learned so much. But the Omicron variant is just what we call a variant of concern. So it is a new version of the virus that has mutated, in this case, about 25 mutations to the spike protein that confer upon it a potential increase in transmissibility, meaning it's more contagious, and also the potential of being able to evade the immune response, whether that's from the vaccine or our own natural immunity. And I think that when we saw the number of mutations, as well as combined with what we're seeing in South Africa with an explosion of cases, or at least the early explosion, it was thought, you know, we should be looking at this a bit more closely, getting some more information on it, and seeing how this could impact the situation both locally and globally.
And can you remind us again, what is the spike protein in a virus again? How do they work in viruses? How do they, communicate with our personal cells?
Yeah, this is really important. And the spike protein looks like to be one of I call it the business end of the virus. It literally looks like a spike on the outside of the virus. And this is kind of what the virus uses to hit certain receptors called the ACE receptors in our nasal mucosa, in our lungs. And that's how it kind of latches onto the cells and then gets into the cells to start the infection and replicating itself. So what we see is that the spike protein is what is also the basis of the vaccine. So we give the body instructions on how to make the spike protein so that it can be presented to the immune system, like with the mRNA vaccines, or with the upcoming Novavax vaccine, we actually give spike protein directly to the body. Then you form an immune response to that. And the concern has been, at least over the last couple of months, is that if you see certain mutations, changes in that spike protein, that might make it so that the body is less able to recognize it, and also might make it so that the virus can get into the system a bit more easily and become more transmissible.
Right. So with more mutations in the Omicron variant, does that mean that it's more transmissible, that it's easier to spread amongst a population?
That's the thing I think that we have to be careful of. And, on one hand, first of all, more mutations doesn't necessarily mean that the virus is any more deadly or more transmissible. That's one thing. The other thing is that let's say if we see a bunch of mutations that we saw in previous variants, that, okay, look, if you have this particular mutation in this variant, it made it much more transmissible. If it's there and there's multiple of these in this variant, does that now mean it's super transmissible? And the answer to that is not necessarily, because once you start to get a lot of mutations in a virus, that can actually work to hinder the virus growth. So we have to remember that just because you have more mutations does not necessarily mean that it's any more deadly. And now taking one step further, let's say if we do have something that does have more mutations, is more transmissible, and is more evasive of the immune system, if you put that into a population, it doesn't mean it's necessarily going to go anywhere because of, say, vaccination on the ground, immunity on the ground from virus exposure. All of these things have to be seen in the real world. And just because you see these mutations doesn't necessarily mean we're going to see a catastrophe.
Mm-hmm. And you touched on it there. What do we know fully about the severity of the illness? Do we know yet if people get sicker from this variant?
Again, early days. Today, what we know is that it doesn't look like it's necessarily more severe. It looks like it's at least as severe. We have some early observations out of South Africa and Israel. What they're seeing is that the people that are being hospitalized, so these are the people with the more severe end of the spectrum, the vast majority of them are unvaccinated, which suggests that the vaccine is doing something, as well as people who have previous immunity from being exposed to the virus. So could this be less severe? It's very, very possible. And there was some early suggestions of that. But I think that based on what little information we have, we can't come to any strong conclusions about that just yet.
Given how transmissible this could be, again, we're still learning about it. What does this mean for people who are vaccinated? Again, you mentioned how this has the potential to evade our antibodies. So what about people who have either gotten antibodies because they've been sick or they've been vaccinated? What do we know about that front?
This could have the implication in that if somebody is exposed to the virus, say compared to the original, we call it the ancestral strain, you're more likely to get symptoms if you are exposed to the virus. So for example, I'm double vaccinated, I get exposed to COVID, and I can get something like a fever that keeps me in bed for a few days, or a sore throat, that type of thing. But there's no suggestion right now that protection against severe disease, which is often mediated by our T cells, is called the memory response. There is no evidence right now that form of the protection is lost. So yeah, you might get a severe flu-like illness that keeps you in bed for a couple of days, or you might have mild symptoms, but the chances of you being hospitalized because you're that sick, that protection has not been affected, at least with the early observations we're seeing.
Right. And as always, with all of COVID, certainly being vaccinated versus not being vaccinated, huge difference.
Absolutely. And one thing I will mention, I think that, of course, the vaccine looks like it's protecting against Delta for sure. And we have evidence that it looks like it's protecting as well with Omicron. One thing I will say is that there is evidence of potential immune evasion. Remember that immunity is not like a light switch that goes on and off. It's more of a dimmer. So yeah, you might have a little bit of chipping away of your immunity protection against infection, but that's very unlikely to affect your protection against severe disease. If you're someone, let's say below the age of 60, but if you're above the age of 60, you have immune compromising conditions, you're in a long-term care facility, this population may benefit from getting a third dose of vaccine to help bolster that initial immune response and still continue protection against severe disease. Because I think in the end, looking at if we have a whole bunch of people that are getting colds but not being hospitalized, I think that's a great trade-off compared to 1 year ago or a year and a half ago, where we were seeing lots and lots of people being hospitalized.
We'll be right back. So the Omicron variant has now been identified in more than a dozen countries around the world, really in about the span of a week and a half. Is that a cause for concern, or is that our medical surveillance system working, that we know where and how the virus is moving? How do you see that?
Yeah, I think that when we heard that this was discovered in South Africa, by we mean a number of my colleagues in infectious diseases, the first thing we thought is, this is just the tip of the iceberg. It's likely everywhere. And I think that's the big thing. For me, what's more concerning, not that it's everywhere, because that's what you expect with a transmissible respiratory virus. What was concerning to me was the response. We saw right here in Canada, all these travel bans made. And again, travel bans in this context don't make a lot of sense because look, the virus is already here. It's already widespread. We're not going to stop it in that way. And I think what's much more reasonable to do, in my opinion, is to, continue with our vaccine campaign on the ground and get vaccines into the parts of the developing world that don't have a lot of people even with their first dose.
I've seen that thought among infectious disease doctors too, that travel bans can buy you more time, but really, once it's in so many different countries, cutting off certain countries, it doesn't limit the spread, right?
I'm going to push back on that a little bit. And I asked the question, buying time for what? I think that certainly in March of 2020, when we didn't have a lot of information about the virus, we had to do things quickly in order to help to blunt any effect because much of the information we had was coming out of China and it looked pretty bad, right? We're almost 2 years into this now. We know much more about this. At the most, if we buy 2 weeks, it's not really going to change anything. We have vaccination on the ground. We have at this point 85% of eligible people vaccinated in most of Canada. We're still on campaigns to get unvaccinated groups covered. So I think that we're doing things, I think, with the best of yield. But in order to, do a travel ban and really affect potentially the large scale economy of a country, especially developing countries, and all sorts of other unintended consequences, I just don't think that buying us time really does us much good.
In the same way that the Delta variant really became the dominant strain over the past 10 months, year, is it reasonable to expect that this variant, the Omicron variant, will also become the dominant strain of COVID over the next several months? Or could it possibly peter out? I'm thinking about the Mu variant that had a big splash and was called a variant of concern by the WHO, but then it didn't become the big wave that we thought it would. Is there any chance of that happening?
Yeah, I think both of those scenarios are on the table. But I will say one thing is that I stand here with humility, things could change, but Delta is a beast. And I think that when Delta came out compared to Alpha, there was a big jump, right? So you saw that the strain replacement, I think, was inevitable based on the characteristics. Delta was just so much more fit and transmissible than Alpha. When you look at Omicron may be more transmissible. There's some early evidence that that's saying that. But I think that the difference between Delta and Omicron is much smaller than the difference between Delta and Alpha. And I make that distinction because I think it's unlikely that we're going to see Omicron suddenly take over. I think it may take over in localized areas, but I just don't see that strain replacement happening in the same way. It might be perhaps a co-strain. Either way, though, I think that looking at what we're seeing, this is not something that I've heard a lot of people saying puts us back at square one. This is just further evolution of the virus. And by the way, one other potential path we go down is we see this ends up being something that's slightly more transmissible, but also less severe. So you end up getting a lot more people infected with mild symptoms. That's also a possibility. Time will tell as we start to gather more data.
In a lot of ways, I feel for you, Sumon, because in addition to your work as an infectious disease doctor, a big part of you and your colleagues in the medical community, it has been about communication over the last almost 2 years now. How important is it to you as a doctor to let the public know, here's what we know, and maybe more crucially, here's what we don't know and we are still learning about?
I think that is of utmost importance. And I think a lot of the impressions on the ground, fears, anxieties have been stoked in an unnecessary way based on both sensational reporting as well as complete discount. You don't want to be on either side of the spectrum. I think honesty is a good thing. The problem is that it's very difficult to control the message in that sense, just because there's so many different media outlets, whether it's traditional media, social media, etc. But yeah, I think that there's been a lot of failure of clear, honest messaging. I think there's been a little bit of paternalism where people are saying that, we don't want to say this because people might take this the wrong way. A thing that I'm hearing a lot is we don't want to say this because this might feed anti-vaccine rhetoric. This is really not a good way. I think we really should trust the public, be honest, what we know, what we don't know, and really try to keep the sensationalism and the discounting completely out of it because that doesn't help anything.
You and I have talked about the nature of viruses on this podcast before, and you made a great point a few months ago that variants are normal in the sense that a virus, in how a virus interacts, that it is in a virus's nature to mutate and change. Sometimes it dies out, sometimes it replicates and becomes more infectious. So I'm thinking about just us as people who don't have medical degrees. With each new variant that comes out, how do you think that we should be approaching that news and taking it in and considering it?
Yeah, I think that that's a really, really great thing to talk about because, I noticed that a lot of people talk about, we're good until the next variant comes on, until the next variant comes. And I think that there's this sense that, which is, I think, incorrect, that we are making a bunch of gains, like climbing up a mountain. And then with the next variant, we just fall back down to the bottom or go back to square one. And that's not the way immunity works. This is something that we accrue with time. We have been living as human beings, as the human race, with viral infection for our entire history. Our immune systems know a thing or two how to deal with viruses. Every pandemic that we've had before has ended, and that has happened with both mutation of the viruses and the accrual of immunity. And I don't see this being any different. With the variants, I think that it's important to realize these will happen. But yeah, while initially this meant a lot of badness, more transmissibility, outbreaks, lockdowns, as we get further into this and we have more immunity, I think that's less likely, even though we will see variants. So I think it's important to realize that a variant, number one, is not the end of the world. Number two, we're not going to go back to square one. And number three is that we should just accept this as a normal part of viral propagation. And this is part of the journey towards the end of the pandemic, which I'm telling you is coming.
We all want to know that date, if there will be that date one day. I just wanted to touch on one last thing, and you touched on it a little bit earlier about how this, in many ways, is about global vaccine equity. We know that COVAX and different countries are feeding into that to try to share some of that vaccination, especially in many developing low-income nations in the world. We know that less vaccine generally means there might be more chances for variants, right? So to you, seeing how diseases move and seeing how this one has popped up in this way, what should people know about global vaccine equity here?
Yeah, I think that this is actually a crucial thing here with the pandemic in general, is that the pandemic is not going to be over for all of us until it's over for all of us. And, we do see that variants do arise in areas where there's a large amount of propagation going. That doesn't mean, again, that we're going to see something that's going to blow Delta or Omicron out of the water. All that means is that, there are people suffering and we really should help them. If you look at the map of the world, where there's the highest amount of vaccines, it's all concentrated outside of Africa, outside of certain parts of South America and Asia. And we really want to be able to help our fellow humans, our fellow people in these places. One thing, it's not just enough to get vaccines there, it's also the infrastructure for delivering it. And that's going to vary from place to place. And I think that not just about putting the vaccines in COVAX, but also helping with manpower, for example, helping with setting up the infrastructure and working with local health authorities and communities. This is very, very important. It's going to be difficult, but it certainly can be done because, look, there's been some very, very impressive vaccination campaigns in the developing world in our history in the last 50 years. So I think the big thing for us to do is remember that, look, rather than maybe getting our 4th, 5th, and 6th doses, I bet that talk will come. Let's get first doses into those parts of the world and really, really for the second half of 2022, work towards that.
Dr. Chakrabarti, always great talking to you. Thank you so much for breaking this down for us and helping make sense of some of the noise here.
Always a pleasure. Great to be here.
And that is Dr. Sumon Chakrabarti, infectious diseases doctor at Trillium Health Partners in Mississauga. That's it for today. Thanks so much for listening. I'm your host, Adrian Chung. Our This Matters team is me, Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bachnick, Raju Mudar, Saba Aitazaz, and Sean Pattinen. Our music is by So Called, Mike DeAngelis, and Sean Pattinen. We want to hear what stories matter to you. Please send us your comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.